Hello, and welcome to this introductory module called the Basics of Health Professions Education, or HPE. The Basics of HPE is an asynchronous learning module of the Health Professions Education, Evaluation, and Research, or HPEER Fellowship Curriculum. This module will provide you with an introduction to the essential aspects of health professions education as it relates to your work as an HPEER Fellow. At the end of this module, you should be able to define the scope of health professions education, describe the history and trajectory of HPE, and articulate the primary organizing domains of HPE content. What is health professions education, and why should I care about it? Health professions education is a field of expertise applied to the education of allied healthcare professionals. It consists of educational programming that provides education and training for professionals engaged in health and healthcare. Improvements in HPE are associated with improved healthcare outcomes for all. Centered in the principles of andragogy, adult learning theory, and lifelong learning, health professions education forms the basis of creating, implementing, and evaluating every aspect of health professions curricula. Now that you know more about the scope of HPE, let's take a look at who is engaged in the study of HPE. Who engages in health professions education? Students of HPE come from a variety of professional backgrounds. In this Venn diagram, you can see that learners may be subject matter experts, healthcare professionals, or both. They include but are not limited to anthropologists, graphic designers, social workers, dietitians, dentists, educators, physical therapists, psychologists, pharmacists, nurses, and physicians. Scholars of HPE bring knowledge from a variety of professional disciplines to their learning. Given the diverse array of professional backgrounds, where does the learning occur? HPE instruction may stretch from the classroom to the point of care, as control over learning is shifted to the practitioner and adapted to the individual. This means that HPE learning may occur didactically in the classroom or applied in a healthcare setting in response to the individual needs of the adult learner. Now let's talk about the history and trajectory of health professions education. The concept of using HPE for improvement of healthcare has existed for a long time. In 1910, the Flexner Report was written with the support of the AMA Committee and the Carnegie Foundation, which advanced the use of German pedagogic style of laboratory investigation as a foundation for clinical training. This report advanced the ideal of medicine as a scientific discipline and established the foundations of evaluating the quality of medical training in the U.S., focusing on clinical partnerships with hospitals, admission standards, physical facilities such as labs, and instruction by physician scientists. The Flexner Report established the first set of criteria for medical education standards, leading to future accreditation requirements and licensing laws, and linking health professions education standards to quality improvement in patient care. The U.S. Department of Veteran Affairs also aims to afford the veteran a much higher quality of care than could be given him with a wholly medical service. In 1946, Policy Memorandum No. 2 was issued, which established mutually beneficial affiliations with medical schools. These affiliations serve to provide high-quality care to veterans through supportive leadership and education to improve the quality of care for all veterans. More recently, the 2001 Institute of Medicine report, Crossing the Quality Chasm, a new health system for the 21st century, recommended an interdisciplinary summit be held to develop next steps for reform of health professions education to enhance patient care and quality and safety. In June 2002, the IOM convened a summit which included 150 participants across disciplines and occupations. The report from the summit focused on integrating a core set of competencies into health professions education, including patient-centered care, interdisciplinary teams, evidence-based practice, and quality improvement in informatics. At the foundational level, the report provided additional recommendations about the reformation of health professions education, including interprofessional and non-physician healthcare professional education efforts to meet the needs of the modern healthcare system and society. The increased number and complexity of training within health professions has led to the creation of several associations and programs that support the development of relevant skill sets. In addition to academic medical centers and medical schools, accreditation organizations and professional societies support the development of these skill sets. Since the IOM Summit and report, there has been an increased demand for HPE. Master's and doctoral programs, as well as faculty development programs and certificates in health improvement education, emerged at leading academic institutions and medical schools. In addition, fellowships and informal training programs emerged to support healthcare providers' development of relevant education competencies. Master's degrees in HPE are the most common opportunity for advanced training in HPE. Globally, master's level programs in HPE have increased from 7 programs in 1996 to 150 in 2018. During the same period, doctoral level HPE programs have increased from 24, including EdD or PhD programs in 2014, to 36 in 2021. The Department of Veterans Affairs Health Professions Education, Evaluation, and Research Fellowship is a 2-year program that builds on this legacy. The aim of the HPEER program is to develop leaders to educate, evaluate, and innovate in health professions education for the VA and the nation. Piloted in 2015 with 4 sites, the HPEER program was continued by the Office of Academic Affiliations in 2020. The Michael E. DeBakey VA in Houston, Texas, was established as a national coordinating center and charged with the development of HPE competencies and a national curriculum for the program. As you may recall, graduate and professional programs in health professions education are intended to develop leaders capable of delivering high-quality education resulting in innovation within health professions education. HPEER program competencies are informed by the existing HPE literature and are organized by 6 content areas or domains. HPEER curricular domains include teaching methods and learning theories, educational assessment and program evaluation, educational research methods, diversity, equity, and inclusion, interprofessional practice and team science, and leadership and management. Next, we'll talk about how the program domains and competencies inform the HPEER curriculum, as well as an introduction to how content is arranged and delivered. Here, we will briefly outline each curriculum domain and its associated content that exists within the HPEER Fellowship. The Teaching Methods and Learning Theories domain includes the skills necessary to provide high-quality educational experiences for learners related to developing and delivering competency-based curriculum in understanding adult learning. The Educational Assessment and Program Evaluation domain includes information on the tools and processes of performance measurement at individual and program levels with the goal of improving learner and program outcomes. The Educational Research Methods domain includes rigorous scientific methods utilized to collect and analyze data to answer important questions in educational research. The Diversity, Equity, and Inclusion domain seeks to develop cultural awareness and commitment to diversity in all aspects of health professions education. The Interprofessional Practice and Team Science domain includes content on effective collaboration across professions and disciplines, including theories of how effective teams function and operate. And lastly, the Leadership and Management domain includes information on developing leadership skills to effectively lead an individual toward educational goals with the overarching intention of improving patient care. Like many professional health professions education programs, HPEER uses competency-based education to deliver its curricula, meaning that the curriculum is designed to directly align with the competencies. Similar to how the competencies are organized using domains or content areas, HPEER curriculum is arranged in modules. Each module's content will typically be delivered over the course of 3 weeks. For the first 2 weeks, you will attend a national HPEER session, which will usually require some form of pre-work or activities to be completed in preparation for the session. For the 3rd week, you will either watch a flipped classroom video or attend a session led by an HPEER fellow. Embedded in the flow of the program are opportunities for you to present your work and receive feedback. Through a combination of national curriculum and site-based mentorship, HPEER fellows learn many valuable skills relevant to leading health professions education. Let's take a look at the types of careers where HPEER fellows apply their skills post-completion. HPEER Fellows take a wide variety of exciting career paths that range from the traditional academic route to more applied positions. Here's a list of some of the possible career paths for HPEER Fellows, including positions HPEER alumni have assumed. We're excited to see the impact that HPEER Fellows continue to make on the field of HPE.